How to correctly use contraceptive pills. Contraceptive pills are considered one of the most efficient methods of birth control. Most of them, when used correctly, are more than 99% effective. However, there are many factors which can decrease their efficacy and increase the chance of an unplanned pregnancy. Find out more about the most common mistakes that can influence the effectiveness of contraceptive pills. 1. Missing a pill. Contraceptive pills should be taken at the same time every day until the blister pack is empty. Missing a dose or taking it late is one of the most serious mistakes that you can make while using contraceptive pills. The effectiveness of some types of combined pills may decrease when you are more than 12 hours late in taking a tablet. However, the efficacy of some mini pills can be affected by as little as a 3-hour delay. If you realise you have missed a pill, take it as soon as possible, and then read the leaflet to find out how to proceed further. 2. Incorrect order of pills. Taking tablets in an incorrect order may damage their effectiveness, especially in the case of multiphasic contraceptives and brands containing placebos. Instructions on the proper use of contraceptive pills are often printed on the blister pack. Always start with the pill marked number 1 or the relevant day of the week, and then follow the direction of the arrows on the pack. If the blister pack doesn't have any markings, start with the tablet in the upper left hand corner, taking the pills from left to right. 3. Not starting a new blister pack on time. Most pills are taken for 21 days in a row, followed by a 7-day break, after which you should continue taking the tablets from a new blister pack. However, with some multiphasic pills, mini pills and brands containing placebos require continued use without any breaks. Remember that each blister pack, regardless of the type of pill, should always be started on the same day of the week. 4. Vomiting or diarrhea. If you have experienced vomiting or diarrhea within 3 to 4 hours of taking the tablet, there is a risk that the active ingredients won't have been completely absorbed by the body. In these instances, you should take another pill as soon as possible. If you have experienced more than one episode of vomiting or diarrhea, use additional contraception for the next 7 days. 5. Combining with other medications. There are many medicines and dietary supplements which can impact the effectiveness of contraceptive pills. Examples include antidepressants, activated charcoal, St. John's wort, and antibiotics. Always consult with your doctor or pharmacist before taking contraceptives with other medication. Always remember to read the patient information leaflet to find out what type of birth control pills you're using and how to take them. Please like our Facebook page and follow us on Instagram.